Okay, we're gonna pass it around. Hi. Hello.
Thank you. All right, according to the CDC, about 5.1 million people have heart failure, and about half of those people will die within 5 years of diagnosis. Heart failure is the leading cause of hospitalization in patients that are 65 years and older. So I chose this topic to inform you what heart failure is, the treatments, the symptoms, and most importantly, how to prevent it. So what causes heart failure? Conditions that damage or overwork the heart muscle can cause the heart muscle to weaken. That's one type of heart failure is systolic heart failure, and that is when the ventricle has to overcome workload of the heart, and it can't pump like it should. The other one is diastolic heart failure, and that's when your ventricle gets stiff and it can't fill properly, so it's unable to eject enough blood to the rest of the body. Causes of heart failure are high blood pressure, myocardial infarction, cardiomyopathy, heart valve disease, and sleep apnea. So I'm going to go over each one of these individually. High blood pressure, that's when the blood pressure is elevated in the arterial system, so your heart is having to work really hard to pump the blood to the rest of your body. So that causes it to work hard, it enlarges, and that in turn weakens it. Myocardial infarction is a heart attack. This is caused by a blocked artery. So if a patient waits too long, it doesn't come to the hospital in time, and we don't get their artery opened in time, they can damage the heart muscle. And once you lose that part of the heart muscle, it loses the function. So you don't have this, the force to push the blood out to the rest of the body. Another cause of heart failure is cardiomyopathy, and that's when the heart muscle becomes enlarged, thick, or rigid. And this is one of the types that can cause diastolic heart failure, so it doesn't feel like it should. Heart valve disease, that could be aortic stenosis. So if you have a heart valve and the opening is narrow and the heart muscle is having to push harder to get the blood through that narrow opening, it causes it to enlarge and then weaken. And that in turn will also cause heart failure. Sleep apnea, we tend to see this in a lot of patients that are obese. So in obese patients, the heart, one, has to work harder to pump blood to the rest of the body, but patients with sleep apnea, if they quit breathing during the middle of the night, it decreases their oxygenation to their blood, to the heart, and that also can weaken the heart muscle. So what are we going to see in our patients? The patients are going to have shortness of breath, exercise intolerance. They might not be able to walk from the bed to the bathroom without, getting short of breath and fatigued. They have exercise intolerance. They may have swelling of their legs, feet, and extremities. They may have impaired thinking or confusion because they're not perfusing their brains, so that might cause confusion. Another thing that happens is heart failure tends to activate the central nervous system, sympathetic nervous system, and that increases your heart rate. So that your heart is trying to overcome the weakness. It thinks it needs to beat faster to get more blood pumped out to the rest of the body. So treatments of heart failure include lifestyle changes. If you smoke, of course you need to quit smoking. You need to eat a low-fat, low-sodium diet, limit alcohol, an exercise regimen, and that could include cardiac rehab for patients that need to be monitored that have heart failure, because some of them tend to have arrhythmias, so sometimes it might be safer for them to go to a cardiac rehab to be monitored while they exercise. Medications that are prescribed for patients with heart failure, ACE inhibitor is one of them. These drugs help people with systolic heart failure live longer and feel better. It's a vasodilator, and it helps to improve the blood flow to the heart and decreases the workload. They're either prescribed an ACE inhibitor or an ARB. Some patients can't tolerate ACE inhibitors. It can cause a cough and other symptoms, so they might prescribe an ARB, which works basically the same way it vasodilates. Another drug that's routinely prescribed to all heart failure patients is a beta blocker. And this class of drugs not only slows the heart rate, reduces blood pressure, but also limits or reverses some of the damage to the heart muscle itself. Heart failure activates the sympathetic nervous system, so beta blocker works to prevent this from happening and slows everything down instead of speeding it up. Some patients may be put on digoxin, and this is another drug that actually decreases your heart rate, but it also helps contractility, which is the strength of the contractions. So if your heart muscle is weak and you need to improve how strong it contracts to get the blood out to the rest of your body, digoxin is a good drug for that. Diuretics are used to decrease swelling and edema. That pulls fluid off of their lungs and helps you to breathe a little bit better. Some patients tend to go into atrial fibrillation, this heart arrhythmia, when they have heart failure. So they may be prescribed blood thinners to keep clots from forming in their atrium. If they're not in atrial fib, they sometimes might also still give them blood thinners, because if you have a sluggish heart muscle, you don't want blood clots to form if blood's not moving as quickly as it should. Patients that have coronary artery disease might be put on statins as well to help control cholesterol, and nitrates in order to decrease preload and afterload so the heart doesn't have to work as hard to pump blood. Other treatments for heart failure include surgical procedures. One of these could include implantable defibrillators. Patients with congestive heart failure that even have mild to moderate heart failure at 30% risk of sudden cardiac death. So a defibrillator can help shock them out of a life-threatening rhythm. Cardiac resynchronization therapy, you might see it labeled as CRT therapy, is for patients if they have arrhythmias or like a heart block. It can synchronize the chambers of their heart, the right ventricle and left ventricle, to contract at the same time, and that improves their cardiac output. Patients that have severe heart failure might end up having to have a heart transplant, so that would be a last resort. And sometimes those patients might get a LVAD or left ventricular assist device, and that's usually put in while they might be waiting for a heart. So those are the treatments for heart failure. In conclusion, 5 million people have this disease, and half will die within 5 years. That's a large number of people that have this disease. So prevention is key, but for patients with heart failure, the goals of treatment are to increase the percentage of blood pumped from the left ventricle, decrease the need for hospital stays, slow the progression, and decrease the risk of death. That's it. Thank you, guys.
We all stay.
2 thumbs way up.
Yeah, we're all